Hi, everybody. Good afternoon. I am so excited for this session today. Alongside me, I have Kassaundra McKnight-Young and Greg Carras joining from Zebra. We're going to talk to you today about the cost of lost clinical time. So when people hear lost clinical time, they immediately think lost minutes. But today I'd like us to reframe that. I'd like to talk about lost opportunities to provide better patient care. This webinar isn't going to focus on products, although we will absolutely talk about some of Zebra's best-in-class offerings. What we want to focus on is decomplexifying technology and helping our health systems optimize their technology investments to ultimately give clinicians time back to focus on better patient care. Kassaundra, I'd love for you to do an introduction to yourself.
Thank you so much, Jean. My name is Kassaundra McKnight. I'm the Chief Nursing Informatics Officer here at Zebra Technologies, and so glad to join you today to have this wonderful and much needed discussion of lost clinical time and lost time overall when it comes to implementing or taking care of patients. Thank you.
Thank you, Kassaundra. Greg?
Hi, I'm Greg Carras. I'm the North America Portfolio Manager for the RFID products and the data capture products for Zebra Technologies.
Fabulous. And I'm Jen Jean. I have the pleasure of leading the healthcare sales team at Levata. And today we're going to talk to you about how when you bring an incredible partner like Zebra and Levata together, building customers for our solutions, we truly can make a difference. There will be time for Q&A at the end, so please feel free to submit any questions and we'll make sure to get to as many of them as we can. So when we talk about lost clinical time, what are we really talking about? Are we talking about the economics of it? We know that our hospitals spend roughly 60% of every dollar that they spend is going towards their labor. But what about the millions of dollars of technology that gets lost on optimized workflows and technology that are not truly optimized? If it costs roughly $60,000 to replace a single staff nurse, and those nurses are losing time on every shift, we have to be able to focus on how we give them that time back. Kassaundra, talk to us for a second about if a nurse loses, 30 seconds here and 2 minutes of there, dozens of time during their shift, it adds up. What does that mean to you?
For me, two things I'm thinking about. I'm thinking about the patient and I'm also thinking about the clinician. When you're taking time to look for something like a bladder scanner, that takes the nurse away from the bedside to care for their patient, looking for lost equipment. And when they do that and things like that, that's taken away from that patient. So they can't, if that patient starts to decompensate or anything like that, that primary nurse may not be available. They may be out looking for some equipment, which that's a problem because it can really impact care. And the second thing, as you said it, is time. All of that time that I am taking to look for things that are really hampering or things I need to help me with the patient adds more time to me. So it really adds that clinician overload and burnout. We work 12, 13 hours a day. And when we get through doing that, we have to chart, right? And so if I have not done my charting or kept up with that care because I'm looking for things or the optimization is not where it needs to be, that affects me as the nurse. So adding to my burnout, I mean, we have a clinician shortage. We've had it for a while, but we are now leaving the bedside at a rapid rate. So all of these different things impact.
So there's clearly an economics to it. What about the frustration that a clinician feels? Alarm fatigue, inefficient communication, like delaying of care. There's a cost to that, right?
Yes. And a lot of times we want to put a cost that is a dollar amount, but I always talk about return on life. That is something that you can't put a value on. So when you look at alarm fatigue, I mean, so many times when I worked in my other job, as I was looking at reasons why alarms were missed a lot of time it's just that they've kept getting the different alarms at the same time. They just started ignoring them. And what about the one time you ignore the alarm? That's the time that somebody really needed help. And it's really because of things like alarm fatigue and just burnout, clinician burnout in general, because of all the friction, using multiple devices, old devices, manual processes to be able to communicate or actually handle tasks. Or what about tasks coming to the nurse that don't really need to come to me? They can really go to the person they're meant to. The nurse has been used many times before as the middleware or as the middleman. And I'm telling you, not one nurse went to nursing school to be a middleman. If you need me, then that's great. But I don't need to be the messenger between the EHR and the other clinicians involved with the care. It needs to go to the right clinician at the right time. So that's the impact.
Yeah, I know I'm certainly a huge advocate for keeping our nurses at the bedside as much as we can. So let's take a second and talk about real life. You mentioned that word, and I think that if you take a look at where we are today, we are in a completely different place than we were years ago. We are living in a world where for the first time, there are more people over the age of 60 than under the age of 5. That is a huge shift in our demographics. And at the same time, you talked about the people that are delivering care are leaving the profession. It's 48% higher than it was just 4 years ago. And everyone that has remained is dealing with, less time, more demands, stagnant compensation, and then workplace violence. I would love to hear you bring this to life for us from your perspective, because when I look at these stats, it's alarming.
It is very alarming, and you hit on so many different areas. People are living longer. They have more chronic disease and illness. So that means they're sicker, right? Compared to where we were a long time ago. Nurses are aging out, they're retiring. And so this clinician shortage is more impactful than it ever has been because those older nurses are gone. And so you have the newer nurses here, the novice nurse. So that critical thinking that used to be there is not there, right? So not only are you looking at a shortage, you're looking at a skill set problem, right? And then let's look at this little to no salary increase. I mean, nurses are not being valued in the way that we need to be valued. We're not being compensated. And it's because of the growing cost in healthcare, and they're looking at how can we keep things low. So operating margins are low. And so nurses are not compensated. So again, all of this is contributing to us leaving. And then one of my passions is workplace violence. I mean, there's been a number of strikes over the last few months. And one of the biggest issues has been the violence toward the healthcare workers. 1 in 5 healthcare workers are attacked 5 more times than any other profession, including first responders, as revealed in an Evolve Healthcare white paper that was released, I think, in July of 2025. And everybody outside healthcare this is alarming to them, but for us, it's our reality. So listen, and having a whistle to blow, running to go push a panic button is not keeping me safe. That is not good safe. By the time I find a panic button or try to get up to a panic button or push or blow a whistle, the damage is probably already going to occur. So we really need safer opportunities for clinicians in healthcare.
Talk to me about how impactful having something like a duress button built into a device or readily at your hands, how would that improve your day?
Yeah, for me, it's really about what you said, being frictionlessness, no friction, seamless, and no big deal. So for me, having a mobile type of duress button on me is great, but one that I can voice activate is even better. So if I get to a situation where I can't actually touch it or push my hand on it, if I can just call out a secret word and allow someone to secretly notify somebody that I need help, and with doing that, they know where I am in the hospital. That is what I call impact. That's something great. I mean, a lot of places, as I mentioned, have panic buttons that you have to push on a desktop or a laptop or on a keyboard or at a nurse's station. Those things can't keep us safe. And I'm not saying even a mobile button is going to keep you totally safe, but what I do know, when you have something seamless, it's going to mitigate the damage. So somebody knows where you are right when the time that you need that help. So allowing them to get to you quicker.
Yeah, and I imagine some of those situations are extra stressful when there's additional people in the room, right? Additional family members, and you've got to find a way to easily and quickly communicate. So some of the technology that Zebra's put out most recently has really helped solve some of that. So really, really excited to see that hit the hospital systems and hearing how impactful that can be to the day-to-day.
Yeah, it's not just that, Jean. It's really working with partners like Levata and other partners to make sure that we're working together to have the best outcome possible for their organization. When you talk about workplace violence, some people don't know that you can actually voice activate. And in the process of doing that, it can activate cameras around that's right there. It can also start video or audio recording. So the person who's coming to actually help you, for example, an active shooter, if somebody's coming to help you, they can see what's going on out as they're coming. See, that's power. And that's going to keep not only the person that's there, hopefully, mitigate that damage, but the person who's coming to actually help you. So there's a lot of possibilities, but it takes partnerships to make those things happen.
It sure does. So clearly there's a lot of economics at play. Let's talk about the end result, the patient. Let's think about the end of every one of our decisions that we're making, whether it's making a technology purchase, refreshing the current technology, looking ahead to something. We need to focus on not only the patients, but the people that are delivering care all across their journey. When you think about how to deliver an impactful outcome, what is one of the few things that we should be encouraging people to think about?
I think that anyone who is looking to implement technology in general, you want to see how is it going to impact not just your patient, but also the clinician. If it does not reduce the friction, then you don't need to add it, right? If it's not going to drive safer patient outcomes, then you don't need to add it. Or you need to look at the way that it's being added. Strategic plans don't care for people. People do. People care for other people. But you do have to have a strategic plan to make sure that what you're implementing makes sense. It makes dollar sense. It makes common sense. It makes life sense. And so when you think about that, and why I love Zebra and work for Zebra now here as a clinician is really implementing and designing technology that drives safer patient outcomes and working with partners like Levata, who not only allows us to get our technology out there, but helps organizations to implement, right? Because we talked about on the other slide, resources are not what they used to be. Same thing that clinicians are leaving the bedside. People have small operating margins, so they've let some people go, like IT resources. So this is where you look at this particular piece here and why it makes sense. So when I think about these three outcomes, how do we get safer patient care? How do we coordinate care delivery and optimize resource utilization? Is not just about the technology alone. It's not just about the people. It's not just about the EHR. It's not just about the organizations. It's really everybody working together to get that. So having the right people at the table at the right time really makes a difference. And a lot of times when you think about technology is people think they can't afford technology. And it's not that you can't afford it. We have to really look at the resources you have inside your organization and are they being used to the level they should be, or can we pivot and take that money, get rid of that resource and put it into technology that you have, because the technology that you currently use is not working. So I think resources are there. They're just not being used properly, utilized, or it's just the wrong resource at that time for that organization.
Yeah, Kassaundra, you know what I love about that? the business side of me, you start talking about a strategic plan and I'm like, I'm going to craft this up right now. But you're right. It's about having the clinical side and the IT side and the security side all together at the table. These are conversations that can't happen in silos. I think about the partnership between Levata and Zebra, and you talk about really optimizing technology. We can sell a healthcare system any piece of technology that they want. But if it doesn't get implemented the right way, if their staff isn't trained on it, if the transition isn't done smoothly, it's just going to be a lost investment. And that's nothing that any of us want.
Yeah.
And I love how Zebra has come up with a framework. I'm gonna switch the conversation for a few minutes to talk about the connected care model, because I think it truly brings together the business, the technology, the patient, and the providers.
Go ahead. I'm sorry.
I know it's okay. I was just gonna say, I'd love for you, when you talk about this framework a little bit, I'd love for you to bring it down into a couple different areas. How are we making sure the right people are getting the right information, the right teams are not feeling that friction, and that everyone is working together? Help us understand this.
So I think a lot of times it's easy to let people understand this orchestrated care framework by giving some examples. Okay. So let's just talk about this, the whole intelligent visibility, empower teams and optimize operations. Most people think that care starts at the hospital once you get inside the doors, right? But care starts when you hit the floor or you hit that parking lot of that hospital. Most hospitals have valet services now, or there's a parking lot attendant. If I walked up to someone in the parking lot and I needed directions, I speak English, so no big deal, right? They could tell me where I need to go and I can get there. But if I did not speak English and I came up to you and that parking lot attendant did not speak English, then we're at a standstill. He would have to get somebody to help me. What if I needed help? What if I'm in duress? And so having technology on your wrist that has a HIPAA compliant translator that allows you to have a conversation with that person, that right there allows no friction, right? That patient can get where they need to go. And just think about if they had a duress situation, even to be able to hit a duress button outside the hospital, either voice activate or push a button, you can do that. See, that is what orchestrated care is. So it allows you to know who needs help and where they are. It empowers that person outside, and it is an optimized operation. And both that clinician or that parking lot attendant and that patient can be helped, assisted. That is an example when I think about orchestrated care. So you think about going inside the hospital and looking at that framework and looking at how, in most cases, people walk up to a kiosk or they walk up to an ED and they want to check in. They have to wait till somebody check them in. Okay, call their name. You could do something, kiosk check-in, and at that point, do quick registration. They know their name, they know their date of birth. Now, you don't necessarily have to print off the wristband right then, but you can have that print somewhere else and somebody can validate that information. But at that point, once I come in, I check in, my name and date of birth, I have actually just been quick registered, and now I can get care. The full registration process can happen later, but at that moment, care can begin for me. And I think that is how organizations, EHRs, partners work together, software, to drive this whole orchestrated care model that we're talking about. So we're taking what you have and optimizing those things, and then cutting out all the unnecessary manual steps. And all of these different things help not only reduce costs, but reduce tech sprawl. So what kind of devices can we get rid of in the process? And then in doing all of this, the process is more automated.
Kassaundra, it's so interesting to me how challenging it is to get all of those people at the table. So when you're in a nursing or a clinical environment, you've got this technology provided and supported by your IT teams, right? But you guys all need to work together to make sure everybody understands the needs. What are some ways that you've seen that be most effective and most impactful to make sure the right people are there at the table?
Yeah, I think when I've seen it work well is when organizations are forward thinking and they know they just done what you just said. They bring everybody at the table, even from the beginning, to saying we need this technology. They don't just let IT decide what works best for their clinician. They bring everybody to the table and they let them really look at these devices or technology in general and make a decision that works best for them, not just what's best for the IT, not what's just best for the clinician, but really what makes best for that organization to drive the best care for their patient. That is what they do. And that's when I've seen it work well. I mean, of course, I'm an informaticist by background. So the organization I came from, they do value that role. And so they bring that liaison that really helps clinical and IT work together in one aspect. But I don't want to just think about clinical and IT. It's more than just the clinical and the IT. It's everyone. Even what I've seen work well, even when we bring in new technology, and even though you're not going to involve pharmacy today or you're not going to do supply chain today, they should be involved in that initial process as well. Because if you think about that whole expansion or that strategic move or your strategic planning later on, you want to see how this technology can impact everyone. And that's where I see it really working well, is when you bring everybody in. It doesn't matter if they're not going to implement today, but they do have insights. They can be thinking about how can we bring this technology and really expand it and future-proof it for our organization to make sure it's the best investment possible for our organization.
Oh, I love that. That would be a key takeaway. I'd love everybody in the audience to think about when partners, like Levata and Zebra are coming to the table for meetings with you guys, and we're asking you to bring more team members. That's the perspective that we're trying to help. We're trying to make sure that we're helping everyone think through not just what's there today, but what could be possible in the future. Because we know it's not one size fits all, and some of these investments are going to be done over years, but we want to plan together early on, right?
We do, Jen, and I think mindset. I mean, we want to change mindsets because a lot of times people are making decisions based on cost, but they're not looking at the total cost, like the total future-proof cost of what's going to happen in 4 years or what's happening. What are we reducing? And I think that's really the biggest problem I see is that, and why it's so important to not just think about the initial cost or what you see is really the entire impact, the soft cost, the reduction. I mean, before I was a Zebra employee back 10 years ago, when we implemented the Zebra product, one thing we did is we reduced 80% of our devices. We removed all of our thin clients out of our room. That is huge if you think about reducing that tech sprawl. We went from 5 devices down to 1. Those things are huge. So that cost that we were spending on pagers, all that other stuff that we were doing, and the biggest thing is we are now connected. We're a connected front line so we can communicate effectively with the entire health ecosystem to keep that patient safe. So I think that is what I'm seeing out there where it works well, but I'm sorry, Jean, what we're seeing a lot of is still people making their own decisions. I mean, I just was on a phone call the other day and the IT person told me that they're going to make a decision based on look and feel. They're going to make a decision on look and feel. And if that's the way we are allowing organizations to serve our patients and our clinicians, it is a disservice. It is a disservice.
I understand completely. When you talk about going from 5 devices to 1, what I think about? I walked the halls of a hospital a couple of weeks ago, And one of the nursing staff that I was interacting with, like, looked like a superhero. There were so many different things were going on her belt and clipped to her. I thought she was gonna like take off down the hall for a second. Let's shift our focus to what this looks like inside the hospital. So Kassaundra, you talked a little bit about that patient journey that starts, I mean, honestly, it starts when you're parking your car and checking in. But talk to me about how orchestrated care looks within the four walls of a hospital today.
Yeah, I love this slide. It's like the slide I love most because really, when you're thinking about technology in general, you should be looking to see how that technology can impact your entire health ecosystem from the front of the house to discharge to at home with that patient. So when I think about the orchestrated care framework, that's exactly what we're focused on here at Zebra and here working with partners like Levata is when whenever we do decide to implement, or the organization do decide to implement something, we're looking at that whole ecosystem. What are your pain points? How can we help you? So I gave the example of the parking lot. I gave the example in the ED, but let's look about once the patient is on the floor. What type of workflows are you doing? How are we, are you taking, are you using a backpack? Are you, the things I talked about, or do you have a scanner to scan with, a phone to call with, a desktop, a pager? Is your nurse being a middle person? Are we, do you have to go pull a WOW or a phone to do translation? Or you wanted me to go look at a system to track something separately? Or when you think about the nurse, like that's the power that I need in my hand as a nurse. And that's what we try to, looking at the orchestrated care framework, is help organizations get there to be able to do in one single device, be able to do ambient documentation using a badge that's connected to your phone on your hip. And then when you have to do things like smart pump program, med administration, yes, you can still receive alerts, but you can make phone calls if you need to, hands-free or not hands-free. All of those different things really think about the clinician. But what about when you think about the dietary worker, the PT and OT and the transporter and security and also supply chain? All of those people are a part of that health ecosystem and need to be connected. And you need to have workflows to be able to do that. And you need to have the hardware and technology to be able to support to do that. So looking at that, we try to really help organizations connect all those dots together. So connecting every person and then driving the safer patient outcomes for that patient. And then not forgetting about the patient when they go home. How can we support them when they go home if they have a hospital at home program or home health care or any thing that we need to connect with the patient at the home. If the clinician needs to go out there, we have things that keep the patient safe, but also keep the clinician safe there. With the duress functionality, but also being able to do those same inpatient functions at home with the scanning and those pieces. So when we look at the Zebra Orchestrated Care Framework, that's what it focuses on. Really seamless care without friction from before you get into the hospital until after you leave, while you're there, and after you go home when you're there to support that. That's what we're really looking at and helping organizations to say the art of the possible, right? There's one, I think about AI. People talk about AI a lot, so I can't leave this conversation without saying that. But you know, a lot of people are doing this ambient documentation where you can document what's going on in a flow sheet. But there's technology out there where I can walk into a room and say, the workstation in room 305 needs to be fixed, and it can create a ticket through my ServiceNow or whatever my ticket platform is. See, that's what powerful is for me. Because as a clinician, we're spending about 41% of our time documenting. So yes, that will help. But what about all the other tasks that we're doing? I just mentioned we're searching for things, right? We are putting in tickets or not putting in tickets, right? Because of things like that. So all those other tasks that are there, any technology or a plan that can help me get to that is what's powerful. That's what orchestrated care is. That's what it looks like. Front of the house, in the house, and after you leave the house.
And we've got to have all the right people at the table together to get there, right?
Yes,
so we're
we
just
do.
bringing everyone together, making sure that we're covering everything from the second you pull into the parking lot to the time you get back to your home, right?
Absolutely, absolutely. A lot of people don't think about dietary. They don't think about transport. I mean, they do, but they don't. So with dietary for a nurse, for me, if there's a diet order change or a patient is admitted, that's mostly a manual process for dietary. But just think about it, if you put something in a dietary hand, something that's low cost, and once that order is put in, it can go directly to the dietitian. They can see it, they can hands free, they can do what they need to do. And guess who gets taken out the middle? Me, the nurse. Because again, I did not go to school to be a middleman or to take on that big old backpack. I really want to work with a tool belt. So help me get there.
I love it. I'm going to skip one slide. We did have a great case study to show you, but I'm enjoying this conversation so much that I want to leave before we transition into RFID and figure out where in the heck all this stuff is that we're losing. How do we help our health systems leave this conversation today thinking about where they are on their current journey and where they need to go next?
Yes, I love this clinical mobility maturity model that's showing right here. And this simply says this: it does not matter where you are. Wherever you are, we can meet you there and we can help support you. If you are just in all these manual processes without any type of orchestration of care or a minimal orchestration of care, we can really work together to help get you where you need to be. So, and if you, no matter where you are on your journey, we're here. And I think with partners like Levata, it makes it possible because I said earlier, a lot of organizations have cut down budgets. So a lot of IT resources are not there. The skill set is not there. And people think they can implement the technology, but what I'm seeing is they get technology and it's sitting on the shelf because they can't get it implemented. The adoption is not there. And so this slide simply says, this is the clinical mobility journey. No matter where you are, we can really help you. We can meet you where you are and help you get to where you want to be.
And I would echo the same sentiments from us here at Levata. That is the journey that we want to be on with our health systems. And we want to start it as early as possible because that's how we help be a true advisor. We're walking the line along with our customers throughout their journey. Kassaundra, this was a fabulous conversation and I really appreciate your time, but I'm now going to switch over to Greg to talk a little bit about RFID. So, what's so fascinating to me is that recent healthcare studies are showing that health systems are talking more and more about real-time visibility, whether it's RFID, mobile computing, et cetera. But when I talk to clinicians, it's not so much about equipment being short or missing. It's more that they can't find it. I can't imagine how much clinical time is really spent looking for things. Before we transition fully to Greg to get us into the RFID, my last question for you is how big is that visibility from your perspective as a nurse in the 12 hours of a shift?
It's huge. I always talk about bladder scanner because bladder scanner must be everybody must just have one bladder scanner because I promise you, we're calling around the floors, finding, does anybody know what a bladder scanner is? And you think about that time that it takes me to walk the floor or call around, up and down. It was on 3 red, wherever it is, but leave my floor to go find equipment. It's a big impact. And that's just one piece, if you think about it. But I want to say this, and I'm gonna let you go to Greg. I was looking at a study recently that we're spending $30 to $50 billion each year. Healthcare organizations are on lost resources, time, medications. And at first I was like, wow. But then I remembered this. As a nurse, we always get these notifications that say, okay, we're out of 1 meal Dilaudid. And so now we're going to be using 2 meal Dilaudid. So as a nurse, to me, it don't mean too much, but I thought about this. At home, you go into the drawer, you grab Tylenol, you put the Tylenol bottle back. At the hospital, it doesn't work like that. So if I get an order for 1 meal and I don't have a 1 meal vial, I get that 2 meal vial, which costs more money. And then what you think I do with it? I just waste it. So this RFID conversation is so relevant today because I think healthcare organizations don't really realize how RFID can really help them in areas like this to make sure that they have what they need before they run out and really help tackle that cost that they're losing each year.
All right. So Greg, let's talk, my friend. How does RFID help us change the conversation from where is it to what do we do next?
Well, so that's a great question. So there's a lot of different ways that you can implement RFID technology and different levels of automation that can be achieved by implementing RFID solutions. So, starting from over on the left, you look at like your real-time location solutions that can be implemented using what are called active RFID tags. These are typically battery-powered tags that beacon, and you can apply these to high-value assets. So they're always reporting their location. So this saves, clinicians or anyone in the hospitals looking for those pumps or the wheelchairs, because they'll always know where they are because that location for the item is always being tracked. Does that kind of help level set the conversation?
Yeah, absolutely. Absolutely.
So
do you?
Go ahead.
Yep, go ahead. Nope, all you.
That you can kind of track last known location by looking at the same type of technology, but using passive RFID tags, which are a little less expensive to implement. They're not battery powered. They can be coded onto labels and applied to really just about anything. And then you can set up portals, overhead readers to track their location as they move in and out of locations. So you can see where that asset is located as well.
Fantastic. I'll let you just take us home on both these before I've got another one for you.
Sure. So also, it provides extensive visibility to auditing locations, see where your assets are. We're using handheld technologies, or even looking at inventory status of all the items that you have, say, for example, in a pharmacy. So you can quickly count for all those assets inside a medication dispensary as well.
So Greg, when you've worked with some hospitals, in the past, wherever they're at on their RFID journey or different solutions they're looking to implement, what's some of the things that have surprised them? Is it, the inventory benefits, the impact on their clinicians, or is it a combination of both depending on, how deep they're willing to go on their RFID journey?
It's really a combination of both, right? So you can either start, working very large scale with RTLS solutions, tracking the invitation or tracking the inventory in real time, or it becomes, a very easy implementation like tracking inventory for medications, which it can be a lot more simpler to implement on a scale, and also have demonstrable ROI behind that versus a complex scenario. I think the biggest thing that we have learned is that don't let just IT implement RFID for the sake of RFID. You typically want to make sure that the workflow is identified, then you apply RFID around that workflow so you can enable a solution effectively.
Greg, if there's 3 things that we get asked here at Levata to advise on when it comes to RFID, it's people, pumps, and pills. So I think we've got a good case study here about medication tracking. Would love for you to talk us through this one.
Sure. So a great application for RFID is being able to easily and quickly and effectively track medication. This can provide a very high degree of accuracy, and also has very proven ROI behind it to reduce waste, improve medication visibility, and also improve patient safety. So encapsulated into an RFID label, the same information that's included in the barcode, you can include things like unique identifiers for that label and expiration dates for that medication. By having that medication expiration date visible, means you can utilize the medication prior to expiration. This reduces waste, avoids disposal costs, and can provide forward visibility to when you can order additional medications so they can be on hand and available for use. This also can help reduce rush orders or duplicate or excess of critical or expensive medications.
Yeah.
By ensuring that you are not, administering expired medication, helps you ensure compliance with the Drug Safety Compliance Act. In all of this, in terms of being able to have visibility to what your assets are for medication, translates into productivity, because using RFID to count that inventory is a massive labor and time saver. And this returns a lot of time to the clinicians when it comes to identifying or locating the medications that are on hand to administer.
I love that. Kassaundra talked a lot about, different costs, right? There's investments in things, but there's also the cost of not doing something. And when I read a statistic like taking inventory counts from hours to minutes, I think of how much more efficient the staff can, or the hospitals can be when planning labor, right? We talked about how much that was of their annual bills. And then we talked about not optimizing technology that a lot of them probably already have. Maybe it's on the supply chain side of their house, or they're using some of this technology. They're just not optimizing it in the right places. I'd love to take just a few minutes. I know we've got some questions that have come in, but I would love you to talk to us just for a second. Don't get too technical on me, but about some of the products that we really should be focusing on and some of their use cases, so that everybody leaves this conversation understanding the power behind Zebra's best-in-class technology.
Sure. So really, to implement medication tracking with RFID, you have to want to acknowledge the fact that most medications don't come with an RFID label already on them. So part of the challenge has been you've got to go through a process of scanning and printing and coding to apply an RFID label with an RFID tag. So with a process that is now very efficient, you can use a 2D barcode scanner to scan the medication barcode, then use a printer, right, which takes that data that's in the barcode and encodes an RFID label through the printer, and then that label is then applied to the medication. So once that process is done, which is now a very efficient and effective process, you can use that packaging that is RFID enabled to take inventory using a handheld mobile computing device, just by waving it around inside an enclosed area to see what assets are available. And that RFID label can be encoded with the same information that's on that 2D barcode, which can include that drug name or the drug code, lot number, a unique identifier, or even the expiration date on it. So that when you're doing inventory, you can put a filter on, sweep around, say, okay, what medications are near expiration, so you can prioritize those for use instead of letting those expire.
I love it. And now I am going to ask you to geek out with me just for a second and talk a little bit about some additional solutions here.
Yeah, so part of this solution comprises of some key elements. One is a 2D barcode scanner, and typically found is the DS9908 HD, which is designed for healthcare and scanning small, high-density barcodes, can parse out all the information. And then you can use a Zebra 621R, which is an RFID-enabled printer, to print out the RFID tag using some RFID Zebra supplies. And once that label is created and applied to the medication, you can use an RFID-enabled mobile computer like the TC22R to actually perform the physical inventory associated with collecting the information for the medication. And of course, the key piece is the RFID inventory software and solution capability that is provided by one of Levata's great partners to fully enable the solution to integrate with the healthcare systems.
Yeah, so we've hit that integration piece again, right? That Kassaundra and I talked about a little bit on just some of the, mobile devices or being at the table together early on in the conversation. I think when it comes to RFID in particular, that integrated delivery and planning is important. One of the very first questions that came in, I'm going to pitch this to you now, Greg. Somebody said, where would we even start with RFID? So I'll reframe that a little bit. Maybe provide some advice, like to organizations that are just starting their RFID journey. Maybe we've got different sides of a healthcare system that think they know what RFID is, or where they want to do it. Where should they start?
Well, that's a great question, right? I think the ideal thing is to start small, right? Start with high value assets that are easily trackable. You know, the solutions like the medication tracking with RFID is something that is relatively easy to implement compared to a real-time location solution with active tags and tracking a bunch of assets at the hospital. So think of something that you can enable quickly and effectively, such as medication tracking. And then again, lead with the workflow, right? The workflow is going to help define the parameters of what the RFID solution would entail versus trying to apply RFID to an existing workflow, which will create some additional challenges.
I love that. I love how the question came in. Where do we start? I think there's probably a lot of people that have that question. All right, guys, we do have a few more questions, but I am going to take a quick second to talk a little bit about where Levata and Zebra's partnership truly can help expand. So we've talked a lot today about clinical mobility and RFID, but I think the bottom line here is that a partner like Levata is really wanting to make sure that we're with you on every part of that journey. So whether it is staying in clinical care, moving into security, talking about your patient experience, your engagement, all the way to making sure that your infrastructure is modernized, that your connectivity is optimized for the devices that you're planning. Levata wants to be that partner every step of the way with you from that journey. And it starts, if you look at the bottom, it starts from where you discover. We're going to meet you where you're at, both from a clinical mobility perspective and from a technology perspective. Be there with you by your side as you design and plan. And most importantly to this conversation is delivering and implementing the solution. I started today's conversation talking about decomplexifying technology and optimizing your investments, but it doesn't stop there. Once we've got the right products for you implemented, we're going to make sure we stay with you to continue to ensure that your staff is trained, everything is implemented properly. And then, we're planning, what does the future look like? I've got two more questions that have come in. Kassaundra, the first one I'm going to send over to you. What are some ways for us to think about measuring the time technology returns to clinicians?
I would, oh my God, that's kind of a difficult question actually, but I would just look at practical moments. I know at the hospital I was at, we actually, did a time study on how long it took me to go back and forth steps, like how many steps, how much time it took me to do. We just did that because we were just trying to get some baseline data. But if you want to look at true time constraints or time efficiency, we also measured the time. We did this too with our physicians, the communication piece, because we didn't have a way to communicate only through pagers earlier. So what we did is we timed how long we made a call to a physician and timed how long it took. We did that for a couple of weeks over different shifts, how long it took for us to get the call back, the text back, or whatever it was, because, the whole doctors are busy, they're seeing patients, whatever's going on. We did that for baseline data as well too. So it depends on what you're trying to share. You have to decide if it's worth you getting that baseline data and how you want to get it for time constraints. But we did a lot of positive KPIs too, based on after implementation on technology. So I think that's, for me, return on life is more important. I appreciate the time question, but being able to reduce falls with injury, like we were able to do that by 57% and falls overall by 34%. So if you think about how much falls is costing the organization, the reduction of hospital-acquired pressure injuries, those are the numbers that are more tangible, I would say, thinking about that. But depends on which time study that you're looking at. Find some baseline data, work on it for a couple of weeks over a couple different shifts to get a baseline if you really want to show that number.
Okay, and I'll throw Levata's hat in the mix there to say we'll also help with, ROI and reductions of, the total cost like we talked about. So I think there's some good ways we can help answer that question, both from a time and a cost perspective.
Yeah.
The last question.
I'm sorry.
Go ahead.
One more thing, people always talk about clunky. I want to talk about clunky workflows too. Like, with our devices, we're not really talking about devices, but we can do tap to pair if we go to the bedside to do specimen collection. So you could do something as simple as, how long does it take me to go in, connect to a printer, print it down, and versus a tap to pair? Like, what does that look like? That's an easy one to do. And also, like, we have a hot swappable battery, right? So how long, some people say they can hot swap with another consumer, but how long is it really taking you to do that? So to be able to have a device that go down and you get a new battery charge. So those are kind of things, practical stuff that you can actually do. I just thought about those. I just wanted to share. Sorry.
No, I love it. I love it. I feel like the next time you and I are at the floor of a hospital together, I'm going to put some of that in play. I'm going to record it. The last question that came in from the audience actually kind of ties into something I was going to ask at the end anyway. So I'm going to try and pair the two together. The question that came in is, what is the biggest barrier to improving clinician workflows? I'm going to ask you to pair that question to what I was curious about. If we look 5 years from now and we've used technology to solve some of these challenges, how is a clinician's day different? So maybe you can answer the biggest barrier, and then what truly could look different 5 years from now with optimized, decomplexified technology.
Yeah. So you said one word, I'm gonna give it two. I think the biggest issue is mindset. I think the mindset, we don't believe what's possible. And the second thing I'm gonna say, true cost. Like, we look at initial cost, or we think it's the cost, but we don't look at true cost. So I'm gonna say mindset and true cost. That's what I look at. That's what I think are the two biggest barriers. And then I think what it can look like is what I was talking about earlier. Me, as any person, can walk up, get the help they need outside of the parking lot, walk in, check in, care starts, and I can do everything that I need to do as a clinician with one single device, or one device paired with a badge of some sort. And every other clinician has that. As the patient's family, I can support them no matter where I am in the universe. If I'm in Switzerland, if I am in China, I can get on a call and I can see, it doesn't matter if I have an iPhone or Android or whatever it is, the platform, and be able to support the care. But a true continuity of care of the patient, no matter where they are in the health ecosystem, that is where it is for me. That's what makes sense. That's what true orchestrated care looks like across venues and across organizations.
Kassaundra, I cannot think of a better way to end this call than with that statement. I cannot thank you and Greg enough for your time and for your expertise, and always for your partnership. I hope everybody has enjoyed spending their lunch break, for those of you that had lunch with us. And we just want to say thank you. The team here at Levata is here to support you at any point, as is your partner at Zebra. And thank you guys for joining us on this lovely Thursday afternoon. Have a great day, everyone.